action.
Hello and welcome back to another edition of Eye Openers, the monthly video blog for North Shore Eye Health and Wellness. We've missed the last few months, we've been a little busy, but Charlotte and I are back to continue our discussion about infant eye and visual health development. So we're back today. Charlotte, or Charlie as we like to call her, is now 7 months old. She's almost 8 months in the next 2 weeks. So she is in the ideal stage for having her first eye exam. At North Shore Eye, we do participate in the infancy program, which is a wonderful public health program that does no-cost dilated eye exams for infants between 6 and 12 months of age. So today, what we wanted to do together was just show you some of the tools of the trade that we have for evaluating infants. A lot of times parents will ask me, well, how can you possibly do an eye exam on a baby? Because they're moving and looking all over and they can't respond to you, they can't talk. So we'll show you some of those techniques that we use, and they are quite neat, and if you've never seen an infant eye exam, they are kind of fun to watch. So really, first things first, in an infancy exam, we're assessing three things. We do want to see how well they are seeing. We'll look for that visual acuity. That is certainly important, but also we're looking for how the eyes are working together. We call that binocular vision development. And then we want to look inside of the eye and make sure that the health of the visual structures like the retina, the optic nerve, and the lens are doing well. So it is a dilated eye exam. We do put drops in their eyes, and the baby will stay dilated for about 24 hours. So there is some light sensitivity after the exam, but really the baby does not have any negative side effects from that dilation. We use toys. Babies like to look at toys. So we'd like to make some noise with toys so that the baby will follow them around. Sometimes they'll even reach for those toys, which is good. And that helps me see how those eyes are tracking, how they're fixating on objects and following objects. So that's a pretty easy one. The other thing that we use, sometimes we need to distract them. And so in a dark room, we use spinning lights. You're probably not picking up the lights here with the lighting, but we'll turn the lights off and we'll move some objects around to get them to kind of feel and get comfortable with how their eyes are following things and get comfortable with me. Right, Charlie? Very good. We use a unique technique for babies to see. It's called preferential looking. And with preferential looking, we have paddles that have gratings on them. And we'll show them a blank paddle as well as paddles with stripes on them. And the child will want to prefer to look at the paddle that has the stripes. And so we have a whole series of paddles with smaller and smaller stripes, higher frequency, which allows me to determine how well they're seeing. And based on the thinness or the frequency of the stripes, I know how well they see. Remember, babies aren't going to see a perfect 20/20. We expect them to see somewhere between 20/40 and 2100 as their eyes are developing. Then I use a tool called a Retina Scope that I can shine into their eye, and when their pupil is nice and dilated, I'm able to assess the exact power of the eye. And I want to make sure both eyes are equal in power and that we should be slightly farsighted. We should have some plus power and not a whole lot of curve to the eye, or what we call astigmatism. If the powers are unequal, that might be something that we need to address. Lastly, I have a little headset that I'll put on, and with this headset and a condensing lens, I'm able to bend light to look inside of the baby's eye and make sure that the retina, the optic nerve, and the lens are nice and healthy. So with these tools, that exam takes, probably about 20 minutes or so, and from that result, we're able to determine, number one, how well your baby sees, number two, do we have proper binocular vision development, and number three, are their eyes healthy and right where they should be at that stage of development. After that exam, we're able to set up a recall for the baby, and typically if everything is healthy, I'll see them back at about 2 years of age. So with that, hopefully we gave you some more in-depth material for baby's visual development and the different parts of our infancy eye exam. Thank you. Have a good day.